Well, now some health news. Heart defects are some of the most common birth defects in America. And because a baby's heart develops so early after conception, much of the damage is done before we even know it started. But now a new study is revealing there may be a way to significantly lower those risks for babies. Here to explain is Dr. Campbell, a practicing cardiologist and assistant professor of medicine at the University of North Carolina. So first of all, let's just take it back to the very beginning. When do our hearts start beating, and when do we actually know about our heart health?
So, early on after conception, the heart begins to form. It's one of the first organ systems to form. And, as a pregnant mother, you get to hear your baby's heartbeat pretty early on in pregnancy.
It's definitely when the reality of it all sort of sets in. It's miraculous that you can hear it so soon. How soon will you know if there's a problem with the heart?
That's difficult to say. Later on in pregnancy, we're able to do high fidelity ultrasounds and actually examine the structure and function of the heart and determine if it's normally formed and all the chambers are where they should be.
When we talk about congenital heart defects, what are we actually talking about?
The most common types of congenital heart defects are actually holes between the chambers in the heart. There are more complex types of heart defects that require surgery immediately after birth. 50% of all children who have congenital heart defects will need at least one surgical procedure in their lifetime.
Wow, and that's, to know that even before the baby's born, it sets you on a different path, really, in your life.
It really does. The good thing is that we are now so good at taking care of babies and young people with heart defects that they can live normal lives.
So let me talk about this new study now. Now that we got that established, this new study is making a connection between the amount of exercise that mothers do while pregnant to whether or not their babies are more likely to have a heart defect. What does this study really tell us?
So this study was done in mice, so we have to translate to people. But what it showed us is that when mothers who are pregnant exercise, they tend to have less rates of birth defects. In fact, when we compared young mice mothers to older mice mothers, we found that if the older mothers exercised pretty vigorously, they had the same rates of birth defects as the younger ones.
Which was less, right? Because
Much
the younger
less.
ones had less. And so really, when we talk about pregnancy and birth defects, oftentimes it's the age, the number that people really focus on. And perhaps this study could be telling us something different.
I think so. I think when we talk about birth defects, it's a very complex interaction of your genes, your DNA, your genetics, as well as environmental factors. And you can't impact your genes, but you can impact your environment by providing exercise and better metabolism for the baby.
Now, for this specifically, when it comes to the heart, why do you think that would be? Why do you think the activity level of the mother would impact the forming of the heart of her baby?
We don't really know at this point, but we do think there's certain metabolic effects that occur when we exercise. We know we reduce blood pressure problems. We know we prevent diabetes. So it seems to me that these positive influences on the mother's body can be translated to the developing fetus.
All the more reason to get moving.
Exactly.
Always a good reminder. Dr. Campbell, great to see you. Thanks
for having me. John?